Hey, Dr. T.
What's up?
Did you know that over 7 million children in the United States have been diagnosed with ADHD, and the testing that they do for it doesn't even get to the root cause?
100%. Isn't that crazy?
Yeah, what's up with that?
Right. It's just more kind of like, are they behaving this way? It's hard for them to do this. And then let's throw a medication at them, right? Instead of getting to, well, why is it happening in the first place? And even if you say, well, it's a chemical imbalance, well then, all right, great. But then what's the next question? Well, why? Why is there chemical imbalance? Why are there hormone imbalances? And that all comes down to really understanding what that missing link is. Many times it's being overlooked is that nervous system. You know, this is a hard time of year for most parents and kids, like going back to school. It's overloading on an already overloaded system. And that nervous system that can already be in a stress state just gets overwhelmed, and it's hard for it.
Yeah, for sure. I've heard a lot of parents mention that.
You know, it's interesting though, there's kind of a side note here. Like I think it was July 13th of the New York Times. It's talking about how, are we really overthinking ADHD, was like the title of the article. And it's looking at how these ADHD medications may be effective at first, but when they further studied these kiddos down the road, after 3 years, it lost its effectiveness. And the only thing that actually was came out as a result of these kiddos at the end of that study there was that they were shorter.
What?
It stunts their growth. Yeah, that's what these medications.
Oh my gosh.
Their actual height, right? Like that's what these types of medications can do to a developing body. And so they lost their effectiveness, but then they also impacted kids' growth.
That's wild.
Right?
Wow.
Yeah.
With ADHD being such an, I guess you could say, epidemic in the United States, I've heard that there's different types of it. Some kind of like raging bull or something. What are those? Of
course, there's, so again, it's all in that nervous system, and no wonder why it stunts growth, because when you just kind of feed on that, and then we'll get to that, is that when we're in a stress state, our body, there's what's called the prednisolone steal, where it's a precursor, will either go to stress hormones or it goes to growth hormones. And so if we're constantly in a state of stress, well, the growth hormone side gets pulled from, because it's more important to survive, right? Not be eaten by the lion, fight it off or run from it. So if it's constantly pumping over here, less of that growth hormone, less growth, right? So to feed on that, yes, there's different aspects of kind of like what they just overall blanketly term as ADHD is everything to do with that. But there's one category, it's not diagnostic, but it's a category characteristics of a kiddo that is a classic ADHD, because it's, you can imagine a raging bull, right? Just all of it, like running around, bouncing off things nonstop. That's the hyperactivity side of it, which also too, it's hard to focus in environments to where, you know, a kiddo may be in an environment where our typical system is at, and they don't learn that way. But if you put them on and where they can learn with their hands, they become unaffected, right? Because there's a lot of kids that don't take medications in the summer and they do great. It's all about the environment we're in and how we react, right? The other one is the drunken bull. So it's the other side. It's that kind of dazing out, not paying attention, oftentimes kind of clumsy, can show up physically that way too. And then there's the third most challenging type, which is the combination of the two, which is the drunken raging bull.
Oh, wow.
Yeah. So that's really a confused nervous system that displays the least best parts of those characteristics. And is really most challenging in life too. That's oftentimes like when you get into really significant forms of like that sensory or even autism, Asperger, like that kind of realm.
Wow, that's interesting. With the traditional testing, obviously it's not finding the root cause, and they're usually throwing medication at you. So it's only doing so much. Like, what else could you be doing?
Checking that nervous system, right? And that's where I love the scans that we use, the insight scan. It helps us really get an objective view into the functional part of the nervous system, which is non-invasive. So it measures nerve to muscle. So we've got 3 different types of fibers in our nervous system. And one is sensory nerves, what we feel, which is about 10 to 15% of the nerve percentage of fibers in our body that we feel. Then there are about 45% that are nerve to the muscle. The motor allows us to move and support ourselves. So we can measure that, particularly paraspinally, and see how much, how little, or how if it's overloaded, imbalanced, or too little as far as that energy there. So we can test that. And then there's the other 45% is what's called the autonomic nerves, which control our systems, right? And we can assess that through a very non-invasive, very highly sensitive paraspinal thermography too. So and then there's also for some kiddos old enough, we can do what's called a heart rate variability, which measures the overall general state of that nervous system. When you do this in a nice and quiet environment where nothing's provoking that nervous system, so we can really see where is our engine idling, kind of like your car at a stoplight, right? Like the RPMs should get back to a nice, healthy idle. Like if you're at a stoplight and the RPMs are revving, you know, hey, there's something up, or if the car is almost stalling, there's something up, right? And that's where it can give us more objectively information about the nervous system.
Okay. It can also kind of detect like where the stress patterns are at, right?
Correct, yeah. And so it gives us quantitative numbers based on, all right, is this more kind of classically that raging bull, classically that drunken bull, or classically that drunken raging bull?
Okay, awesome. Yeah. So ADHD parents got to get those kiddos
just get checked, right? Let's just get checked.
Yeah. Awesome. Right. Thanks.